So one of the things that we're responsible for doing is actually investigating these diseases and infections that are reported to us.
What are the first thoughts and pictures that come into your mind when you hear the word epidemic? Thousands of sick people, confusion, even roadblocks or quarantine zones? Some of that may be Hollywood fantasy, but what does an epidemic really look like?
Hi, I'm Bill Metz with Jackson County Close-Up, and we're here today with Stacey Gregg. Stacey is a registered nurse, and she's also the clinic manager at your Jackson County Public Health. So thank you so much for joining us today.
Thanks for having me.
There's probably some confusion surrounding terminology used when talking about the spread of disease in our community. Can you clear some of that up for us and give us a brief description of words like outbreak, epidemic, and kind of related terms?
So an outbreak is really an increase, and it can be sudden, in the number of cases in a certain population. So when we talk about outbreaks, a lot of times we're speaking of an increase of cases just in Jackson County. So it's some examples of that would be, a diarrheal illness like norovirus at your mother's long-term care facility or nursing facility, or maybe it's a bunch of cases of whooping cough in some of the elementary or middle schools here. So those are some of the things that we look at and that we track. When you're kind of looking at bigger, when we look at epidemic, and that's often a really dramatic word that's used in the media, but the definition is pretty much the same as an outbreak. It's just that maybe we see a much larger number of cases, or maybe it's a much larger geographical area, or something like that.
Beyond a particular place.
Right. So, or it could be a region. So, one of the things that I think about that happened just kind of a couple years ago was Zika, right? There was kind of a Zika epidemic in like South and Central America. So that's something that we think about. Or we're seeing syphilis on the rise across the United States. And so that is something that we would call, an epidemic. And then looking kind of worldwide, globally, when an epidemic kind of spreads over countries or continents, that's what we call a pandemic. A couple of years ago, there was the H1N1. That would be a good example of a pandemic.
So what does public health do to respond in each of those situations here in our community?
The first thing is we hope that people are reporting these things when they're seeing them.
Okay.
It is required that, that people report outbreaks to the local health department. Sometimes, facilities and individuals and community members just don't know that that's what they're supposed to do. But then we do our typical investigation to try and figure out what exactly is causing the outbreak. Is it something like noro? Is it flu? And then we kind of devise a plan working with the facility, with the community group or the school to work on implementing control measures. So that might be, if it's in a nursing home, cohorting sick patients, putting them all together in one wing.
Gotcha.
It might be offering or encouraging vaccination to folks, or providing them with medications that would limit the severity of the infection, And so it's a lot of working collaboratively with community groups and community organizations and nursing facilities and schools to really help them do the right thing so that we prevent spread amongst, people that come into contact with those folks, but then also, hopefully containing it and keeping it from traveling to the greater population.